Very common bilateral knock knee, but this child came to me with a very early age, that is around 8 to 9 year of age, and we did a very small surgery. It is called as growth modulation, and we were able to correct this with a very small surgery through a growth modulation surgery. This is a very interesting case of a dislocated hips. This was seen by a pediatrician for a painless limb, and then he was referred to physiotherapist. So physiotherapist started physiotherapy and gave them some shoe raise because of the limb length inequality, but never went for any kind of x-ray. So my first request is, whenever there is a painless limb, always ask for an x-ray or first make the diagnosis and then start physiotherapy. This child was first time diagnosed with a dislocated hip at the age of 5, which is present at the time of birth. So there was a delay of almost 5 years, and we have to undergo a very big surgery called as femoral osteotomy, pelvis osteotomy, and luckily we got a good result that the child started walking. But there was a limb length equality also, but this should not be neglected in India, at least because of so much awareness in physiotherapy. A very rare case where there is a bend in the knee and there is a 15 centimeter shortening of the legs, and patient were advised amputation and prosthesis, but we tried to correct it with a Elizarov correction. We were able to correct the deformity, and this is how we corrected the deformity gradually, and this is the first time child started walking. We are planning for his femoral lengthening, but there is some financial issues with the patient, so at present she is walking on a foot raise. A very rare case where there is a brachial bulge palsies, and these are called as internal rotation contracture. The physiotherapy tries to improve this, but this is actually a bony deformity, and you can never get a good results by any kind of physiotherapy. We did a humeral derotation osteotomy, and this is a 2 years follow-up. The child can do everything. So first you need to pick the disease, what are you dealing with. Don't start physiotherapy at the most, first get a diagnosis, and then you can get a good results. Sometimes you can get a traumatic ruptures. All extensors were cut with a wrist through a very sharp putty machine injury, and we repaired all extensor tendons, and we can get almost a normal hand with a complete good range of motion. And again, physiotherapy plays a very important role after tendon repairs, and we need a very experienced therapist to manage them, otherwise contractures can develop. A very interesting case, a torticollis, which is a very severe torticollis at the age of 13 years. There was a complete right SCM contractures and nothing is going to work. We straight away went for a bipolar release, which is an extensive release of the sternocleidomastoid muscle, and after that we put on a cervical traction, and we can get a good results. This is just a 2 months follow-up. The child has almost 50% improved. With the therapy and a bracing, we can make them as normal as possible. A cubitus varus deformity post-traumatic, which is like a bend at the elbow. It can be easily corrected by again osteotomy, and we can get a complete hand. A very interesting case, a child, she was 8 years old and she got some childhood infection at the hip, resulting in a marked shortening of the femur. You can see that the femur is almost 5 centimeters shortened, and when child walks with such a shortening, there is a very severe limp. And with this, we actually lengthen the femur by a fixator, which is called as monolateral fixator. We were able to lengthen the 5 centimeter of femur completely, and this is how after lengthening the bone reconsolidates. And the parents were so happy that now she started dancing, and you can see that the child can dance with a normal limb on both the sides. And this is the last follow-up. She came to me to give invitation for her marriage. So now she is of marriageable age. In Muslims, they used to marry little early, and the boy could not notice any kind of deformity in the child, in the baby. With this, I end my talk. This is actually a treatment, is a combined approach by a physiotherapist and a doctor. So no one alone can make the patient happy. We need a combined approach, and that's how we should work so that our patients can get maximum benefit. Thanks a lot.
Thank you so much, sir, for such practical knowledges and